take more risks. I think it's helped, as I talk through different services, different businesses, different staffing models, like let's take a risk and it might fail, but it might be wildly successful.
What inspired you to become a PT? And then what triggered you to say, you know what, I want more out of this. I want to move into leadership.
Yeah. So I think like most physical therapists, it started out because I got hurt in high school. And so I was, in the training room and with the physical therapist that actually lived a couple houses down from me. And so, I got to see the clinical setting. He actually, came and took care of me and helped provide some treatment at my house. And so just being able to see, wow, you could do this for a career, get paid to do it, and, not have to sit at a desk or do something like that was really intriguing to me. And so, since high school and kind of spent my whole college career anticipating that I would apply to PT school, and obviously did that and went through that program. And that's really all I thought I ever wanted to do was work in, outpatient orthopedics and sports medicine. But I had some mentors and some folks, leaders that invested in me and kind of opened my eyes to, hey, you can go down this path and be a subject matter expert and, purely focus on physical therapy. And that's, certainly a good path to take. But there's also these other cool opportunities out there in healthcare that maybe you're not the expert in, but you can bring your background and your skills and abilities and apply it to, practice management, or at the time it was occupational medicine. And so it wasn't an intentional choice. It was more of just like, okay, it seems like this door is opening and some people are investing in me and encouraging me to do something different. And so it just kind of said yes to that opportunity. And then you look back, 10 or 15 years and you're like, wow, I started out here in physical therapy and now I'm, way over here in a leadership role or in practice management. And I've always said that I don't think I've ever interviewed a practice manager that said, you know what, I'm going to go to school. That's all I ever wanted to be was a practice manager. They kind of evolved into that role, whether it was because they were, a nurse or an x-ray tech or a medical assistant, and they just kind of grew up with the practice. And so I think it's been, my career, as well as I think a lot of folks in practice management and operations, it's kind of a evolution because you just kind of grab a hold of the opportunities that are presented to you.
Yeah, definitely.
Thanks for tuning in to the Healthy Careers podcast. In 2024, we reached over 32,000 listeners and ranked in the top 15% of all podcasts. We're proud to have SharePro Health as a sponsor and are currently looking for 2 more partners in 2025. If you're looking to connect with healthcare leaders, providers, and innovators, we'd love to spread the word about your service, product, or business. Reach out to me, Maddie, for more details.
I think in healthcare, that also defines, in a sense, the culture, right? Of if you're offered that opportunity and you're doing a good job in what you do, there's always going to be that other alternative route or option for you. And it might require, I noticed you went back to school to get your MBA, and I want to hear about that. But sometimes it requires you getting additional schooling. And sometimes it's just, people learn through exposure to it, learn through, hey, I was working with a small practice and I was doing half of the things anyway because I was, it was kind of like a wear all different types of hats situation. But either way, I think it is important for people to join groups and have mentors. It sounds like you had a few as well that advocate for you and don't let you just stay kind of like this, because you can, and there are people that are fine with that. I've always wished that I was that type of person. Daily, I'm like, how come I can't be okay with working at Dunkin' Donuts? But then again, it's also a blessing to say, hey, I've got the ambition and I want to continuously improve and learn new things. And if you have that mentality, I don't think anybody needs to stay exactly where they're at, within the first few years of their career and then beyond.
Well, that was one of the things that got instilled into me was at Ohio University when I was in their physical therapy school, is they really emphasized lifelong learning. And so obviously there's 2 components to that: lifelong learning to stay on top of your profession and be up to date on the latest treatments and techniques in physical therapy. But then there's also this, lifelong learning application, to your point, of like, maybe I can do something different, and maybe I can take, what I learned in physical therapy school and apply it to my MBA or to, a different physician group. And so I think that lifelong learning maxim has stuck with me since PT school, and that's kind of guided my career throughout.
Yeah. Because a lot of medical people, when you go to train for something and it's so specific, or you think about, and I think it's different, obviously, and when you think of physicians and surgeons, like they are medically trained in one thing. They can't just be like, oh, I'm a surgeon, tomorrow I'm going to be a family practice physician,
That's right.
But with a lot of other things, whether it's PTs, PAs, NPs, there's such a variety in what you can do, not only clinically, but in leadership. And a lot of times I think people kind of pigeonhole themselves. And they just think, okay, if I started out and I'm a neuro PT, that's all I'm going to be, right? And then it's like, hey, no, you could jump and do, occupational med, you could jump and do orthopedics, you could jump in and do inpatient. It doesn't limit you in terms of what you're able to do. And I would argue that the person who's had more of a variety is going to be that better leader because they've had exposure to all different parts and pieces of every side of the business. And I think sometimes school almost... That's good that your school taught you to be a lifelong learner, but I think a lot of times they almost teach you to just have this narrow mindset of like, this is what you're doing for the rest of your life rather than seeing it as a buildable skill set.
Yeah.